Hi, I am Patty. Welcome to my YouTube. And I want to talk to you today about ARFID and what that is, what that means. ARFID is a very fancy name. It's an acronym for Avoidant Restrictive Feeding Intake Disorder. And what that means is there's an experience of very selective, severe, sometimes labeled as picky eating. Now, I've seen it in beautiful humans as young as 4. I've seen it in beautiful humans as old as 42, 52. And so it's not necessarily experienced at a certain age, certain gender. I've seen all genders. And what can happen is it can really interfere with someone's experience with food. Typically, we start to see a lot of ARFID and neurodivergency. And so that means sometimes diagnosis of autism, ADHD, a lot of different ways that it can show up is sometimes people say, oh, they're just a really picky eater. What I see with someone with ARFID is their nervous system is on overload, meaning the sensory experience of eating is so scary or so fear-based that there is a very few selected amount of foods that feel safe for someone to eat. What society might see is, oh, that kid is very picky, or the parents have been shamed because they've enabled the kid to only have certain foods, or the kid can just do whatever they want, or there's not enough family structure in the home. So there's so many different ways that the conversation can go. But if I were to focus just on the person, whether they be 4 or 54, is their experience with food feels threatening, meaning they're very familiar with safe foods. So safe foods mean they can eat, the person can eat without feeling nervous or self-conscious or any sort of discomfort. Typically, someone that experiences ARFID has a very small select type of food, and they're typically very, very similar. And typically we start to see foods that are considered junk foods as safe foods. So junk foods would be things like Pringles or saltine crackers, one kind of pasta, maybe a specific very cold, crunchy vegetable, if vegetable. And what we start to see is the selection of foods is predictable, meaning every single can of chips or every single bag of chips is typically going to be the same. Every time I have a Lay's potato chips, it's the same experience. Every time I have a saltine cracker, it's the same shape, it's the same experience, it's predictable. My nervous system isn't going to be taxed with the unknown. And so you start to see safe foods that are the same color. Well, it's a sensory experience. I can tell that it's the same color. It's not going to change. It's not going to be unpredictable. Same texture, usually hard and crunchy is easier than soft or gooey. Sometimes warm foods, if the whole food is the same temperature versus like a hard outer shell, like fried mozzarella sticks, that would be sometimes really, really hard. So you want to think about, is the food packaged? If it's packaged, it's typically safer because it's made the same each time. And what is the consistency like overall? So if you want to keep the food safe, if you're trying like a plate, you want to have all similar textures, similar colors, and a lot of safe foods. To introduce new fear foods or a challenge food or to try a new experience, there's got to be a lot of talk, a lot of compromise. If the child, sorry, my dog is back there. If the child is nonverbal, and some of it's going to be a lot of modeling and sometimes waiting where, okay, I am going to be providing foods that I might deem as unnutritional or lack nutrients, and what can I do to provide more of that so the eating experience is okay. I work with a lot of parents who feel like their kid is not getting enough protein or enough vegetables or kind of all of these. They're trying to work on the goal of variety, or they're trying to work on the goal of like a nutrition goal, where my goal is going to be, how can they experience food safely, and what does that look like? How can we get them to even just understand that we're trying to help them develop skills to explore food in a safe manner? And sometimes that takes years, sometimes it takes days, sometimes it takes months. I've worked with a lot of different cases who have accelerated really fast in exposure, and some who just have a really challenging time with exposure of food. And you think about what can affect the nervous system at a meal, so many different things: the conversation, the people, the environment, the day, hormones, so many different things can tax our nervous system, mental load. And so we want to be really kind and aware that ARFID is not just looking at the food, it's looking at the entire experience. And the food does play a big factor, but the support system also is key. Education is key. Exposing safely is key. Having a treatment team is key. My practice, we do see clients with insurance for ARFID, but also outside of insurance. I have a program where we could involve the family and do 12 weeks of kind of redefining your relationship with health. And I think it would be valuable if you're an adult and you're able to kind of think about concepts with food. If you're not an adult and you're a teen, let's see how we can have a conversation, how I could help you. My contact information is in my bio. If this was helpful, please like and subscribe and follow along. Okay, bye.